Okay. Good afternoon, Harlem and Harlems of the world. I am Terri Wisdom, and this is Harlem Network News. And as many of you know, Harlem Network News is a new media platform, and we started at the onset of COVID, and we are still here. It's been extremely critical. When we started, we just jumped into the deep water, and one of the reasons we've been thinking about it for a long time, but once COVID hit and, Black people were walking around Harlem, people of color saying, I'm Black, I can't get it. We knew that we had to really take some action. And I think some of that is that they did not see themselves on mainstream media. So we have here today with us one of our honored guests, and that is in the person of Dr. Icilma Fergus. And you may recall that at the onset of COVID, Dr. Fergus came on many times, sharing with the community as a trusted person in the community that people could relate to. Dr. Fergus is the director of Cardiovascular Disparities at Mount Sinai Medical Center. So Dr. Fergus, if you would just say hello and explain to folks what that is, what that means, and what you do, who you are, and whose you are. Thank you so much, Dr. Fergus.
Certainly. Good afternoon. Good afternoon to you, Ms. Wisdom, and to your listening audience. It's a pleasure for me to be here today, this wonderful Sunday, and I'm looking forward to having a conversation. As Ms. Wisdom mentioned, I'm an associate professor of medicine, but also director of Cardiovascular Disparities at the Icahn School of Medicine at Mount Sinai, the Mount Sinai Health Systems. Disparities relates to issues that are unfortunate, unfair, and unnecessary. So it focuses on bringing everything to equity. And so if you have, you're not having, equitable outcomes in health, in finances, in your resources, and where you live, all of those are disparities. So certain things actually contribute to disparities, such as racism, elitism, meaning, upper middle class versus people who are maybe poor, education. It relates to access. It relates to also ageism. So older people may be discriminated against as well. And another term is ableism, where, some people are not able because they may be, we don't use the word handicapped anymore, but disabled. But if you're not able to get around, for instance, difficulty getting into a place because they don't have a ramp or access to reaching buttons and doing different things, that's also discriminatory, and that also can lead to disparities. So the solution for disparities is finding things that are equitable that can alleviate or ameliorate these types of issues. So that's what I do. I spend a lot of time, actually focusing on education to improve health literacy. So, to reduce the bad outcomes that may come from lack of education or miseducation. As Ms. Wisdom spoke about, people had a lot of misconceptions early on in the COVID pandemic, which most likely led to very, very sick people or people dying. So this is one of the things I focus on in terms of disparities, and you'll hear a little bit about that too. Prevention can help to eliminate a lot of that as well.
Okay, well, thank you so much, Dr. Fergus. And, we're talking about medicine, talking about health, but when you give the breakdown, that spirals out to so much of what our Black and Brown communities are dealing with. So it's really a holistic issue, and the fact that you're addressing this as to our medical health is incredible. Would you just tell us a little bit about what your journey has been to where you are? I always want our audience, whether they're young or old, like you said, knowledge and information is power. That's one of the mottos that we have here at Harlem Network News. So if you could just share a bit about that, and I know it's extensive.
Sure. Well, first of all, let me just say that people think that it is a very long journey towards being a physician. And so we're seeing very low numbers these days of young people of color going on to becoming a physician, for instance. We have about 13 to 15% of African Americans make up the U.S. population, but you have only about 3 to 4% of doctors who are Black African Americans. And then when it comes to cardiologists, which I am, it's about 1 to 2%. So, but I'm here to say that it's absolutely doable. It can be done, and you can do it. I did it, so if I can do it, anyone can. I started out my journey at Harlem Prep. I was a valedictorian there, and then I went on to Columbia, where I studied pre-med. And lots of my friends were pre-med. Some ended up becoming, OBGYNs or other things, but then from there, I worked a little bit at Columbia Black Building because I didn't know if I wanted to be more of a scientist or a clinician. And then I decided I wanted to be a clinician. So I went to medical school. And so I really traversed all of the boroughs except for Staten Island. So I did my medical education at SUNY Downstate. I actually was going to go to Dartmouth, and that's where I got in. But then I felt like going to SUNY Downstate would offer me an opportunity to see more people that I want to help and really go in the direction that I wanted to go. So I did my medical school training there. Then I went to the Bronx, right? So I went from Manhattan to Brooklyn.
And SUNY Downstate, just for clarification, is that in Brooklyn?
That's in Brooklyn.
Okay.
That's over there. The SUNY Downstate, State University of New York at Downstate, which is affiliated with the HHC, Health and Hospital Corporation, which is not Jacoby, Kings County, so that's associated with that. Then from there, I went to the Bronx and I trained in my residency, which includes an internship residency. I was a chief resident also at Albert Einstein, and that's affiliated with Jacoby Hospital, which is another HHC hospital. And then from there, to focus in cardiology, I went to Cornell Medical Center. So that's on the Upper East Side, the New York Hospital, Cornell, And so now, after that, then I became an attending and I went to Queens. I worked at the New York Hospital of Queens.
Okay, so you definitely the boroughs. And here at Harlem Network News, for those of you who are just joining, we are continuing our celebration of women's herstory. And we're going to continue that all year long, celebrate and celebrate and celebrate. And we have with us Dr. Icilma Fergus, who is Director of Cardiovascular Disparities at Mount Sinai Medical Center. And we want to congratulate you, Dr. Fergus, because you were just honored by the Greater Harlem Chamber of Commerce. So we salute you for that. And often our heroes and sheroes are unsung. So it's really important for us to just celebrate us. It helps us, it encourages us. And, with the great work that you do, I know what it's like. A lot of times you're there in the field and you're toiling and, doing everything that everybody has to do. I know you have a family and you're doing the work with the community. So, it takes a lot of energy. How do you mix all of those? How do you keep all those things going and take care of yourself and your health and keep balance?
Yeah, that's an excellent question. I know when I started to go into the field, especially of cardiology, because there's not that many women. It's a very demanding, sort of very strenuous type of field. People were like, oh, maybe you can't get married and have children and all that. I've gotten married. I have 3 children and I have a career and I do a lot of other, things. I'm involved in a lot of, social action types of organizations such as Alpha Kappa Alpha sorority, and I'm in the Links and I'm Jack and Jill. But I have to say it takes a village, it takes a village to help. I know with Jack and Jill, especially my kids really, that really helped them to formulate and grow up and become, go into their own. But it takes a village. And what I tend to do is I compartmentalize. So I really plan my days and my weeks. Because if you don't plan, and for me, if you're not like organized and planned, then things can really go awry. Because, I have such busy days. But, I think if you plan ahead, if you have a village, you have a circle of friends, you have people around you who are like-minded. But I also surround myself with all people from all walks of life. Because you know what, you'd be surprised what you can learn. Everybody learns, all the time, and I learn. And I think by doing all of that, it helps me to kind of get my situation together so I can help others.
Okay. Yeah. Well, thank you for sharing that, because it's important to work really hard, and stay focused on what you have to do. But balance is important too. So absolutely. Social, and when you speak about the party and social clubs, it's interesting, but there's also a focus on community and health, so that's, and I think that's a health circle. And even in terms of the children, and Jack, which explain a little bit about what that is, but it's nice that the children or the young people can interact and learn social interaction and social skills, because it's really, really important. So, thank you for that. Okay, so moving along, Dr. Fergus, what are some of the things when it comes to healthy heart? We're always saying healthy heart. I think this is even Healthy Heart Month. Comes to women of color in particular, men of color. We're always hearing on the mainstream television that, heart symptoms and all these things for women different, and then from women of color, it's a whole nother level. So can you break some of that down for us, please? Thank you.
Absolutely. I think that, first of all, let me just say, heart disease still remains the leading cause of death. Cancer is coming up very close behind, and we're seeing a lot of cancers now. There are treatments of cancers, but let me just say, if you don't have a heart that's strong, any condition you have, you probably won't survive, because you need that heart, or you won't do as well. So you need to have a very strong heart. And if it's just a heart condition itself, it's 80% preventable. But if you have an underlying heart problem, and then on top of that, you have like a lung problem, a kidney problem, cancer, whatever, it will just really minimize your likelihood of surviving. But that being said, we know that some of it is genetics, but we know that a lot of it is preventable. And so you have these risk factors. Risk factors mean those are things that can promote or increase your likelihood of having a heart condition. And everybody should know what their risk factors are. Those are, so things like blood pressure, hypertension. Everybody should know what their blood pressure is, and everyone should know that their blood pressure should remain between, about 110 to 130 or less, over 70 to 80. You should get that blood pressure measured. Make sure your blood pressure is good. You can affect your blood pressure just by how you live, by what you eat, by sleeping, by, drinking enough water, minimizing alcohol use, getting enough exercise. So some of the risk factors, they kind of all interrelated, because again, another one would be diabetes, right? And we're seeing a big, rise in, especially on young people with diabetes, blood sugar elevation. This can lead to heart disease down the road, but diabetes itself can lead to kidney disease and, limb problem. You see these young people with, things on, we call them lesions, but like you have sores or you have other ulcers or things on your feet that won't heal, non-healing ulcers. You can end up having a stroke from hypertension and diabetes. So, watching what we eat, those supersized meals, to minimize those, eat less, a smaller portion, and eat less processed foods. So I'll tell you, if you can't identify what some of the ingredients are in a food that you're eating, you shouldn't probably be eating it. Okay. Because a lot of these, you buy the things and you're looking at the label, right? I don't know if people look at their labels and it has something like
absolutely
monosodium glutamate or some other thing. Do you know what that is? So it's best to eat things that are not processed. Yeah. These risk factors I mentioned, So also, you want to stay physically active. You want to watch your weight. Those are risk factors. Obviously, it goes without saying.
Yeah, we're still here with Dr. Fergus. You froze just for a little minute. We're on technology. So would you repeat, you said the risk factors, and then you were speaking a little bit about diabetes, and if you could go on, thank you.
Yes. So we said hypertension, we said diabetes, and we said watching food, reading food labels, watching what you eat, watching the portion sizes, watching what things are. When you buy it from the supermarket, does it have a label with things that you can't recognize what's inside of it? If that's the case, you probably should not be eating that. I don't know if you heard that, but yeah.
Thank you. Yes, I did hear that.
Yeah, moving. Moving. You want to move 30 minutes most days of the week, strenuous exercise. And you want to get enough sleep and water. So those are some of the risk factors that can be modified. And if you do that, not only does it help the heart, but other risks for even for emphysema, COPD, for breast cancer and the other cancers, eating right, keeping your sugar down, your blood pressure, believe it or not. And, basically keeping the weight down actually helps you to survive from some of these cancers as well. So yeah, they're all sort of interrelated.
Oh, well, thank you for sharing that. And I think in this world, Terri Wisdom, Network News, I'm here with Dr. Icilma Fergus, but we kind of know what we have to do, in a broad perspective, but the question is doing it, looking at the foods, because now I know there's and, not the basic foods, or when we were back to the farming. So we really because we have a lot of new technology, but there are things that getting to the heart situation and the hypertension. What are the differences that women have to look at as opposed to men have to look at? And are there differences that people of color have to look at as opposed to not?
Yes, very important. So I don't know if I'm coming forward clearly. I think at times you were also freezing as well. So let me know if I'm.
Yeah, no, you're good. Everybody's good. Thank you.
So for women, we tend to be, especially Black women, we're the matriarchs. We take care of everybody else and we often leave ourselves behind. But everybody who's been on an airplane, it tells you put on your own mask first and then you help others. So we tend as Black women to really get involved with our different organizations, all the things we're doing. And then we'll say, you know what, I'll go to the doctor next week or next month and I'll wait to get my blood test. But I'm here to tell you, put yourself first. I know y'all all be looking beautiful, putting on your makeup, getting your hair done, but that's all on the outside. You got to take care of the inside. And I think that, that is sometimes neglected for us, but because of our situation generally and a lot of the stress associated with it, we tend to get blood pressure earlier on in life and it's more severe and we need to have more medications on to get them treated. So we tend to have that as a factor, some socioeconomic factors, access. Some of that definitely is an issue compared with other people and in people in general of color. Sometimes there's a lack of trust from, just not maybe connecting or really identifying with the provider or just feeling that something else is going on. So I'm here to say, just really try to find somebody you can trust, because sometimes just staying away because you don't trust something that was easily fixed now becomes something that is secondary or tertiary, a difficult, maybe uncurable because you didn't go in the first place. A simple example, for instance, Miss Wisdom could be like, I talked about that foot ulcer that people could get with diabetes. And unfortunately, sometimes a lot of our Black patients, they lose their limbs because by the time they go, there's maybe gangrene that happens. People wind up on dialysis because of their kidneys, because it doesn't hurt, but your blood pressure is uncontrolled, your kidneys get damaged, and then next thing you're in dialysis or a stroke. I'm seeing a lot of, especially younger Black women now having strokes. Strokes are because of stress and hypertension, high blood pressure. And if you're not managing the blood pressure, which is again, a silent killer, and the stress, you end up with a stroke. So I think that, for people of color, in general, we have to be very mindful at being very active in our own care, finding providers that actually provide the information for you, the access, and asking questions. Just don't take things for granted, because sometimes, you take things for granted, it's an issue. And above all, don't neglect, yourself. If there's an issue, it's best to go and they tell you there's nothing wrong, versus, you wait around and then it's too late. And if you find there's an issue of trust, there's definitely organizations or, institutions you could go to where you could find people such as myself, who will be able to either talk to you or direct you to someone, that we know would be good for the lungs, for the kidneys, for infectious diseases, for sickle cell anemia, for the skin. Oftentimes, people will say, well, who do you recommend for such and such? And I know that this person, works well with members of the community, then you'll make a referral. And soon you'll have a network of, providers or access to things that really help you. So, come on in, ask questions, don't be afraid. Take care of yourself, put yourself first. That's what I would say, because definitely issues affect us as brown and Black people a lot more in more significant ways.
Yeah, absolutely. And that's why I'm so grateful for you to come on. And, at the onset of COVID, you and some of the other Black and brown doctors from the community, it really made a difference, because it's, like you said, it's an issue of trust. Mm-hmm. And also people have fear, around, like, if they are feeling like they may have something, they feel afraid. So thank you for that. We're getting near the end of our time. You could just speak a little bit about COVID. I know you were very active with COVID, and there were aspects of COVID that impact the heart and vascular systems. But where are we now with COVID? Are we seeing as many COVID patients? What about the long-term symptoms? What do people have to be concerned about?
Mm-hmm. Well, first, let me just say that COVID is just one of potentially many other viruses that can come. So it's the coronavirus that was, that affected people back in early 2019 or so. So it became COVID-19, but coronaviruses are rampant. This particular variant has mutated over time. So there have been several variants, and as you know, quite detrimental to us as humans. We've found vaccines, we've found boosters. Not everybody has had a vaccine or booster. Some have vaccines, but not boosters. This virus mutates, and it will find new variants. Some of the variants are deadly, and some we can fight, because now we've had immunity, either by having the infection itself or by having either the vaccines or the boosters. It has not completely gone, and we have not completely conquered it. I still have, up to today, a patient told me she got it, and because of that, she couldn't come in. I would say that if you've had, a previous exposure or some of the vaccines or boosters, it's a much less severe, type of infection compared with how it used to be before. But people can still, die or get very sick, so do not take it lightly. We know that when you get infected, sometimes now you could take the Paxlovid or antibodies, things to shorten and to minimize the symptoms, but it's still out there. I know now people are not wearing masks as much. In the hospital, we wear a mask because, of course, you're going to see sicker people there. But on the airplanes and so on, people are not wearing a mask. But let me just explain to you something. COVID is not the only infectious agent out there, right? And bottom line is, when your particles from your mouth or nose goes into someone else's and you're infected, they're going to get it, whatever that thing is. So it could be the flu, the other, colds and things going around. So I would say to people, just be very cognizant, continue to be very cognizant. If you see someone coughing or they look sick or whatever, kind of keep your distance. Don't drink after people. Don't drink out of the same glass. So
Absolutely.
always, wash your hands often, because sometimes things are on your hands. You put it in your mouth or whatever. Just be very, very clean. Try to wash, try to stay well. When you get home, take a shower. Before going in your bed,
Okay.
like that, just clean up so that, you're not like harboring, and also keep yourself healthy, right? Again, people who had their hearts were strong, etc., they were able to get through COVID pretty quickly. But if you were really sick and you had a weak heart, or it affected your heart, that could be a problem. So we do have some people, and I have a couple of patients still who have what's called COVID long haul, where they continue to have either shortness of breath, tiredness, or they just don't feel right. Some people have lost their sense of smell or taste. Some haven't regained it. So, as you continue to try to heal yourself, and you try to take your autoimmune types of supplements and antioxidants, you exercise, you eat well, some of those symptoms will, minimize. Some of them go, some take a shorter time, some take a longer time. But there is a fair amount of people who still have COVID long haul. Unfortunately, we can't predict who's going to have COVID long haul symptoms. But if you get through the case pretty quickly and you're pretty healthy, you should have a pretty, good outcome. Still around, hasn't gone, still there, but not as severe.
Okay. Well, thank you for sharing that. Thank you for sharing everything. One more subject, and then we're going to wrap up. But because this is just being spoken about so much, women of color who are having problems with pregnancy, across the board, no matter what their economic, educational status is, what can we do about that? And why is that happening? And it seems like it's happening more now than it has before.
Yeah, there certainly seems to be an increase in female maternal morbidity, meaning all the conditions that can occur with it, but also morbidity. You're seeing some, fetal and maternal deaths, and it's affecting Black people and brown people, women more. Now, what can I say? I would say, first of all, ensure that your body's healthy before you go into pregnancy. Things such as being extremely overweight can be difficult. Your blood pressures, if you're not paying attention to your blood pressure and you go into pregnancy, you can't take certain medications to manage the blood pressure. There are only certain medications that can be taken. So if the blood pressure goes out of control, you end up with something called preeclampsia or eclampsia, which could be deadly. You can end up with kidney failure. You can end up with heart failure. So make sure that your body is well equipped, that you're taking your prenatals, that you see your doctor earlier, that you're paying attention to that. Now, I would say too, as Black women, we're doing a lot sometimes with our hair. There's some data.
Thank you for raising that.
Right. Some of the data out there showing that just some of the chemicals that we're using, whether that is a contributor, it could be possible. I would say that we have to also be very mindful. It's coming back to nutrition, what you put in your mouth. Because again, you have a lot of now processed foods that have all kinds of different ingredients in it that are not necessarily healthy. So I'd say what we put on our body, what we put in our hair, it absorbs into the skin, and what you put into your mouth is important. So, knowing all of those, being as healthy as possible, managing your blood pressure, your sugar, and your weight should help. And going to see that doctor very early and having them measure everything, hopefully will have, an impact on reducing this rise that we're seeing in morbidity and mortality for mothers and their new babies or the fetuses. But let me just say one more thing. I think that's pervasive to everyone, and it's how you're managing it, is the stress, emotional contributors right now, stress, anxiety, depression. We're seeing a huge rise in that after the pandemic for various reasons. People were shut in. They didn't get to interact. People lost jobs, lost money, lost loved ones. People were not interacting as much, so they didn't have that body contact. We're seeing a lot of stress and anxiety in the younger people now. They're having the suicidal and all of that.
Absolutely.
So, right. So I think that, stress and anxiety is important. So pay heed to the emotional the emotional contributors are very, very, very important as well.
Okay, well, thank you for that, because, that goes unsaid, and especially, like you said, with the young people, and there's great about technology. Some of that can bring stress too, because I know when we had to sit at the computers a lot, even to work, they were always saying, oh, it's important, get up, walk around, look at the sun, hear some music, so there's a lot of factors. And speaking, because this is another thing that's happening in our society. We have now had the legalization of, recreational marijuana and all of these things. And, it's happening, but it's also a concern, like, how is this impacting young people, their development? I think as the legislatures are going one way, we've also still got to keep the medical factoids. So if you would just comment on that very briefly, and then we want to hear about a little bit about your books and the community work you do, and closing out. So thank you, Dr. Fergus.
I think that, there's medical marijuana. I mean, the drug itself, and I don't want to use the drug metaphorically, drug meaning the medicinal components of marijuana is very good and can help with pain, etc. But the hallucinogenic component of it, can lead to other things as well. And then along with that, you can have other types of, usage of other drugs like painkillers. A lot of, sometimes now we're seeing overdoses from fentanyl and other opioids, that sometimes go hand in hand, that are very easily available. So I think, we need to pay a lot of attention to that, because, not everyone can actually utilize some of those drugs and be able to handle it. It can end up leading to, addictive behaviors and then adding other things on. So I think that the legislative leaders have to pay a lot of attention to that. But, parents have to be aware, younger people are using it and getting overdoses or side effects. And the community, this is something we got to take on as a community, to talk about it, because widespread use is now available. And so we have to, have an action plan to make sure that we're actually addressing, those issues. So I think programs such as yours out there, putting stuff on YouTube that people want to see, getting to the young people, getting to people at all, however you could do that, that's great. I've tried to reach out into the community. As you know, I had programs that I started back in 2011. They were really more focusing on mature adults, thinking that they would bring it back to the family. And so we had workshops, we had outreaches, demonstrations, screening, and referrals. And I've written several booklets focusing on various conditions such as hypertension, diabetes, heart disease, women, and emotional issues. But I would submit to you that we need to have additional ways of reaching out to the younger people of our society. They're the future. Without them, we're not going anywhere, right? So we have to figure out, what medium can we use to reach them? Is it TikTok? Is it YouTube? Is it is it Facebook? Is it Twitter? Is it a music concert? What can we do? And what can we have our major TV stations do? People look at a lot of TV, they look at reality shows. Can they incorporate, things in it that has to circle around health? A lot of it's, when you look at all these shows, it's glamour. Nothing wrong with that. It's relationships, right? Glamour relationships. And okay, so you have other things too that are interesting to, like mystique, like mystery and so on. But throw into that, while that's happening, something about health, something about emotions, something about using, substances. Build that in an informational way that is productive, that people can take away from them as well. So we have to figure out clever ways of getting that information out to our young people as well.
Right. Thank you for that. I just do this without mentioning that, because we know even with cigarettes, for how many years people were smoking cigarettes, and really it was glamorized, and they were not knowing and understanding, especially back in the day, that there was a direct correlation on problem. Now they're finding this out later. So thank you, Dr. Fergus, for joining us on Harlem Network News. Could you just name, because I know you did some cookbooks, books on health. So if you could just name some of those and where people can find them, and they can get in touch with you or some of your programs, so that they can really, they need, and any closing statement that you'd like to share with the Harlem Network News audience and the Harlems of the world.
Sure, so, thank you. Thank you so much for having me here today. I'm also known as Dr. Icy. So if you Google Dr. Icy, I have some of my work residing on ISU online. However, if you really want to get information, you can reach out to me at Mount Sinai, Dr. Icilma Fergus, Cardiovascular Disparities at Mount Sinai. If you reach out to my office or you email me, my office number is 212-212-241-3271. So if you reach out or send it.
Just repeat that number for the audience.
212-241-3271. Or reach out to Mount Sinai, go to the website. You can reach out to us there. My community website is www.healthyheartseries.org. www.healthyheartseries.org. All one word, no spaces. Okay. And it's a pleasure. I hope you got a little nugget out of what I had to say today. We said a lot.
We did.
But hopefully you retained at least one thing. One thing is, a lot of this is preventable. You could do it yourself. Ask questions. Don't give up. Look beautiful on the outside, but make sure you're beautiful on the inside as well.
Okay. That's great. Thank you, as we're in this time of faith and all of the holidays of Easter coming up, Palm Sunday, the Passover, so much of this faith time happening as we're in this springtime. So we appreciate you, and folks can see this on YouTube, Facebook. We premiere at 4:00, but it's always there so people can look at it more and more and more. And I'm Terri Wisdom, Network News. You can always reach out to us at 646-39, HarlemNetworkNews.com, Harlem Network News Gmail. We're totally accessible and boots on the ground in community. You can make donations to us, in-kind services, or if you have information that you think is important, because a lot of times the drumbeat doesn't get to everybody. So please do that. And thank you, Dr. Fergus, for just taking the time.
My pleasure.
To be with us and to inform us, not just power. And have a great day. And we're going to take those nuggets, especially women organizing their time. Yes, you can. Okay. Yes. You got to be organized. So Thank you. Have a good day and blessings.
Take care. Bye-bye.
Thank you. Okay. Bye-bye.